The short answer is it absolutely is. When one knee is recovering, the other knee becomes your reliable, everyday knee. Standing up, sitting down, climbing steps, shifting weight, carrying groceries, it's doing the lion's share of the effort, and it feels that increased load. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle, and today we're looking at something that affects a whole lot of people after knee replacement, but rarely gets talked about enough, and that's the other knee. The knee that likely didn't have surgery, or maybe it did. The knee that's been doing the extra work while your surgical knee heals. And many times, the knee that already has some level of osteoarthritis. By the end of this episode, you'll understand why the opposite knee sometimes feels more tired or achy, what research says about its role in balance and fall risk, and what you can do to keep that knee strong, steady, and comfortable. You'll also hear how this fits into the bigger picture of whole body recovery. And since this connects beautifully with prehabilitation or prehab, I'll share a quick update about the book I'm writing on prehab, with more details available at totalkneesuccess.com. To make this real, let's return to our pretend friend, Meg. We're making it real by returning to our pretend friend. And Meg is from the last episode. Around 4 weeks after her knee replacement, she noticed the other knee more than usual. Not painful, just more present. A little tired at the end of the day, and she wondered if that was normal. The short answer is it absolutely is. When one knee is recovering, the other knee becomes your reliable, everyday knee. Standing up, sitting down, climbing steps, shifting weight, carrying groceries, it's doing the lion's share of the effort, and it feels that increased load. But research adds another layer to this story. One of the clearest studies on the subject comes from a prospective research project involving 376 people who were followed before and after total knee replacement. The researchers found that falls dropped sharply after surgery, about 15% before surgery, down to a roughly 3% risk 2 years later. But they also found that the severity of arthritis in the opposite knee was one of the strongest predictors of fall risk, both before and after knee replacement. If you've ever heard a surgeon or therapist mention the Kellgren-Lawrence grade, here's a quick explanation so it's not so mysterious. This grading system is a simple, widely used way to describe arthritis on X-ray. 0 means no arthritis. 1 is very early, questionable findings. 2 is mild arthritis with some small bone spurs. 3 is moderate arthritis with definitive narrowing of the joint space. And 4 is the severe, quote, bone-on-bone that we often hear people describe stage most people think about when they hear the word arthritis. In that particular study that I mentioned earlier, people with a grade 3 or 4 arthritis in the non-surgical knee were more likely to experience balance challenges and falls. So grade 3 is moderate with joint space narrowing, and 4 is that severe bone-on-bone stage. And this is where another important piece of information comes in, because people often worry when they hear it. Research has shown that about 20 to 40% of people eventually need the other knee replaced within a decade or so. Now, before that number makes you crazy or anxious, here's what I want you to hear clearly. Most people who fall into that percentage, they already know their other knee has arthritis long before surgery. They've felt it, their x-rays confirm it, and it's really not a surprise. It's likely just the natural progression of arthritis that began many years earlier, not something caused by the surgery or anything in particular that you did wrong. Another group of researchers looked closely at balance changes from 2 to 24 weeks after knee replacement, and their work helps us understand why the non-surgical knee can feel so involved in early recovery. As the surgical knee is healing and still regaining strength and coordination, the body naturally relies more on the non-surgical knee to maintain stability. During those first few months, as balance gradually improves, the opposite knee is essentially the anchor, which explains why it may feel more tired, more active, or you might notice it more. Even though the research focused on overall balance changes, its real-world meaning is that your other knee is contributing significantly to how steady you feel. And that contribution becomes especially clear in the early weeks when the surgical side is not yet fully reliable. We also have strong evidence from a large systematic review that physical function doesn't improve in a perfectly straight line. The biggest changes often happen between 3 and 6 months, but self-reported progress doesn't always match performance-based measures like walking speed. And if the opposite knee has arthritis, that difference can feel more noticeable. The non-surgical knee often ends up setting the pace for how fast you walk, especially early on. That doesn't mean you aren't improving, it simply means both knees contribute to the overall picture of how steady, fast, or fluid you feel. Movement quality is part of the picture too. In a study exploring dynamic knee control, researchers found that how well the knee stays aligned during stepping or squatting relates to changes in pain and function. Now, in day-to-day terms, this doesn't mean anything dramatic. It's not about the knee caving in or collapsing. What most people notice is something subtle. Maybe the knee drifts inward a little when they get tired, or they feel like their weight shifts in a way they can't quite describe. When the non-surgical knee becomes the main helper, it may have these small changes in movement or feel more fatigued simply because it's doing more than usual. These little shifts match exactly what the research describes, but not everyone experiences them the same way. Prehabilitation research also gives us helpful insight. In one study looking at how people benefited from structured prehab before surgery, those who strengthened their hips, thighs, and calves ahead of time had better function not just in their surgical knee, but in both knees. When your whole lower body is stronger, your joints share the workload more evenly, and this is one of the reasons I'm writing a book on prehab, to give people an empowering, evidence-based roadmap before surgery ever happens. Stay tuned for its release in late 2025. Another set of findings comes from large-scale analyses of rehab care. When clinics followed structured, evidence-based rehab guidelines, patients had better strength, better function, and more predictable outcomes. And that stability helps both knees, because the non-surgical knee isn't left to compensate for slow or uneven strength gains in the operated side. And since we're talking about factors that influence knee stress, it's worth mentioning one more thing. Research consistently shows that a higher BMI, which is your body mass index, increases the mechanical load on knee joints and is associated with more severe arthritis. So maintaining that healthy BMI when possible and appropriate may help support the other knee over time. And we'll dive deeper into that and even into newer weight loss medications and how they're impacting people in a future dedicated episode. Strength is a very important part of this story. Several newer analyses highlight that early quadriceps strengthening, which we've heard about before if you've listened to any of my other episodes on strengthening, and that's early quadriceps strengthening starting as soon as your therapist clears it, reduces the amount of pressure placed on the opposite knee. When your surgical leg gets stronger sooner, your body stops relying so heavily on the other side. Even small improvements in quadriceps strength can shift the workload, easing symptoms in the non-surgical knee and making walking feel more balanced. While we're on the topic of how the body adapts, it's helpful to understand how the hips and trunk respond when one knee gets overloaded. When the non-surgical knee is tired or arthritic, people sometimes increase side-to-side trunk movement to take pressure off the joint without realizing they're even doing it. Or they rely more on their hip muscles to pull themselves through the movement instead of using the knee the way they normally would. These strategies aren't wrong. Your body is just doing them automatically. They're protective. Your body uses them to get through the day. But strengthening the hips, thighs, and calves allows your body to return to a more natural, efficient movement patterns. So what can you do right now to support the other knee? One of the most important things is consistent, progressive strengthening. And this has to be appropriate strengthening. We have to be careful not to overload that knee if it's already feeling overloaded. Remember that stronger thigh muscles help with sitting and standing. Stronger hips control alignment, and stronger calves help with smooth walking, and they also help with balance. Your therapist can help tailor exercise to your needs, but the key is that steady, repeatable rhythm. Another helpful habit is paying attention to where your weight is. After surgery, people tend to lean heavily on the non-surgical leg without even noticing it. A small shift toward a more balanced standing posture, so shifting your weight to the center and shifting it to the center while you're walking, that can make a meaningful difference. Walking remains one of the best things you can do for both knees. It nourishes the joint surfaces, improves circulation, and supports confidence. Shorter, more frequent walks tend to feel better than the big, exhausting walks. Think consistency, not intensity of doing it all at once. And pacing your day can make all the difference. Instead of doing every errand or household task in one big block, many people find that they feel better when they break things up into smaller, more manageable pieces. Maybe you do grocery shopping in the morning and save laundry for later. Maybe you alternate standing tasks with sitting ones. These small choices prevent fatigue from building up in the non-surgical knee and the surgical knee as well. They help both knees stay happier throughout the day. So if your other knee feels a little stiff or achy after a day with more standing or errands, that's usually a sign that it's been working hard. It's not usually a sign of harm, but you do have to pay attention. This is a good moment to remind you that noticing discomfort in the contralateral knee, which is the other knee, is extremely common. It does not mean that the knee is going bad, necessarily. It does not mean that you're heading straight for another surgery. It simply means you're asking more of that joint right now. With time, strengthening, and more even weight bearing, that achiness often improves. And if it doesn't, it's a good reason to reach out to your healthcare provider. And that brings me to a bigger point. Your other knee isn't a problem waiting to happen. It's a knee that's been doing its best to support you. The more you strengthen your legs, balance your weight, and move in ways that feel sustainable, the more confident and steady both knees become. And before we wrap up, I want to remind you, always pay attention to your pain levels and be in communication with your healthcare team. If you'd like to explore more resources mentioned in this podcast, you're welcome to visit totalkneesuccess.com. You'll find some Amazon affiliate links there, not because the show is sponsored, because at this point it's not, but because if you choose to purchase through those links, I may receive a small commission and it's at no extra cost to you. And that support helps keep the podcast free and accessible. As you continue building strength and steadiness, remember that your other knee is part of your whole story. Your whole body is involved in this rehab process, not just one knee. And that other knee, it doesn't have to be perfect, but it does need to be supported with consistent strength work, thoughtful pacing, and healthy movement patterns. You can help it feel stronger and steadier in the months ahead. And next week, I'm excited to bring you something that can make a huge difference in how prepared, calm, and confident you feel before surgery. In episode 27, we're diving into the pre-surgery confidence checklist, a motivating, practical guide to everything you can do, or most things you can do, in the 2 weeks before surgery to prepare your body and your home. This one's packed with meaningful, doable steps, and I can't wait to share it with you. Thanks for listening. My name is Michelle, and this is the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.